My name is Melissa Young, and I'm going to be performing my head-to-toe assessment on my mother. We're going to go ahead and get started with our neuromuscular exam. I've already sanitized my hands, and I've already gotten a background and history on my patient. First, we're going to go ahead and start with facial symmetry. It looks normal, spontaneous blinking. I'm looking at the ear, and structures of the ear look normal. I'm going to go ahead and check the hair. It is evenly distributed on top of the head. There are no masses or lesions or any abnormalities in the scalp or the skull. At the same time, I'm going to go ahead and palpate the back of the neck for any masses or abnormalities, and there are none. We're going to continue our examination by palpating and examining the lymph nodes, and those are normal as well. Blinking is spontaneous. Color of the iris and the pupil are normal, so is their shape. Sclera is also a normal color, no redness or blueness. Can you go ahead and shine a light in your eyes, okay?
Okay.
Go ahead and complete our perla. Pupils are equal, reactive to light, round, and accommodating. We're going to go ahead and continue our examination by doing our cardinal movements for our eyes, okay? I'm going to have you follow my finger. We're going to go ahead and look up, down, right. I'll put my fingers down here, up here. Perfect. We're going to go ahead and check for nystagmus. I'm going to have you follow my fingers left, right, and then I'm going to zoom in, okay? We're going to go ahead this way, this way. Nystagmus is not present. Accommodation is normal. I want you to go ahead and smile for me. Big smile. Frown. Go ahead and raise up your eyebrows. Okay. I want you to stick out your tongue for me. Say ah.
Ah.
Good. Perfect. Our tongue is protruding like normal and is midline. I see no abnormalities on the uvula or any abnormalities in the mouth. Teeth are beautiful, smile, and intact. There's no abnormalities there either. I'm going to go ahead and have you plug each nostril and breathe in a little bit more. Good. One more time. Patency is normal. I'm going to have you smell this candle. What do you smell?
Hyacinth.
Perfect. My favorite smell. And now I'm going to go ahead and I'm going to have you close your eyes, and I'm going to brush a cotton ball against your skin. Right? Can you feel that on your forehead?
Yep. Yes. Yes. Yes.
Good. I'm going to go ahead and have you clench your jaw for me, and I'm going to pull on your chin, and I want you to resist me. Good. And I'm going to resist me. Good. And shrug your shoulders for me. Perfect. Okay. We're going to perform a whisper test. I'm going to go ahead and check your hearing. I'm going to, you don't have to move, I'll go behind you. And then I'm going to have you plug one ear at this small portion, junction of your ear right here, and press in on the ear that we're not examining, okay? I'm going to start behind you. And I'm going to whisper, go ahead and start by plugging your right ear. We're going to examine your left.
And K5.
Good. Go ahead on the left.
AT3.
Perfect. Good job. We're going to go ahead and move on to our muscular senses. So I'm going to have you go ahead and squeeze my hands. Good. I'm going to have you resist me. Resist my pushing. And I'm going to do the same thing on the lower extremities, which you might not be able to see on the video. But I'm going to go ahead and push against my hands. Good. And resist my push. Good. All extremities are equal and bilaterally strong. There are no issues that I can determine for that. We're going to go ahead and move on to our pulses. So we're going to start by auscultating, which is listening with our stethoscope, our carotid arteries, and we're going to do that one at a time. I'm not going to put the stethoscope in my ear because I can't hear myself talk. So we're going to go ahead and start on the left side. And we're going to go ahead and start on the right. Good. I'm going to feel your carotid pulses. I'm going to go ahead and start here on the left and then on the right. It's important to note that we do not want to auscultate or palpate the carotid arteries at the same time, as these feed the blood to the brain, and including at the same time could cause your patient to pass out. So that's generally frowned upon, so we don't want to do that. I'm going to go ahead and assess our brachial pulses bilaterally, radial as well. We're going to do our popliteal, and then we're also going to do our dorsal pedis, and then our posterior tibial. They're all equal and strong bilaterally. There are no issues. I don't feel any abnormalities with our pulses. Moving on to our pulmonary. We're going to do a little bit of a different layout because for some of these you need to be laying down. So we're going to start with our sitting up portion first of our lung assessment. First, we're going to inspect the thoracic cage. As far as I can tell with her sitting, you can relax that bump.
Okay.
As far as I can tell with her thoracic cage and the way that she's sitting, I don't see or sense any abnormalities. She's not sitting at an unusual angle. She's breathing comfortably. There's no increased work of breathing. Do you have any shortness of breath or any issues with your breathing?
No.
Perfect. So we're going to go ahead and start by listening. I always find that this is a little less intrusive than percussing. So we're going to start by listening to our lung sounds. We're going to start at the apices. The right, we're only going to have 2. I'm sorry, we're going to have 3 lobes on the right and 2 lobes on the left. Breathing is normal. We're going to continue by checking our breathing bilaterally on the sides. You want to listen to each breath sound bilaterally by checking the left and then the right, and then by not continuing that way that you can tell the breath sounds are the same. Okay, so the rest of this is primarily going to be completed on your back. So I'm actually going to have you not lay down, but I want to have you turn because I need to, there you go. And we're going to stay sitting up. See if you can face a little bit more towards the back, but kind of like, I'm sorry, this is awkward on the couch, so we're just going to make it work. Okay, perfect. So I'm going to go ahead and listen to our breath sounds back here as well. I'm going to have you breathe normally. Let's start our ABCs. Good. I'm going to have you state the phrase 99 a couple times when you hear my hands move down your back. We are checking for our tactile fermentus, and this is we're going to feel the vibration as we go down. Go ahead.
99, 99, 99, 99.
Good. As we're doing this, I'm also testing to make sure that the rib cage is normal and that there's no masses or lesions in this area. We're going to go ahead and percuss our lung sounds. I'm going to have you go ahead and breathe in for me. Good. One more time. And out. Go ahead. One more time. There's no dullness to be noted. I do hear resonance, which indicates that there's air and no indication of pneumonia or fluid in the lungs. Okay, this portion I'm going to go ahead and have you lay down on your back with your head over here. And on this one, I'm actually inspecting the precordium for pulsation and heaves. So we're going to go ahead and place our hand here at the left clavicular midline, and we're listening for at the apical portion of the heart to check for the gentle thrumming of the heart. It should be consistent and gentle with no heaves are present. Perfect. Now I'm going to go ahead and have you sit up again. Maybe we'll hopefully not give you any vertigo. We're going to sit up like normal, like you were at the start. We're going to move on to our cardiac assessment. So I have already cleaned my stethoscope. That's very important. We clean work area. And I've washed my hands because I did touch the lower extremities of my patient. And we're going to go ahead and start. So I'm going to place my stethoscope on your chest and listen to the sound of your heart. Do you have any questions?
No.
Normally I would disrobe my patient at this point, but this is my mother and I think we're going to leave her dignity intact, and I will just explain where I place my stethoscope instead.
Thank you very much.
So we're going to start with by placing our stethoscope on the aortic valve, and that's on the second intercostal space on the right side. We're going to move to the left side on the second intercostal space to the pulmonic. We're going to move to the third intercostal space and listen at Erb's point and the second pulmonic. We're going to move to the fourth intercostal space to listen to the tricuspid portion. And then we're going to go ahead and listen to the mitral portion at the fifth intercostal space, which is also where the apical point is. It's important to note that we're going to repeat this process with the bell of the stethoscope to determine if the patient has any murmurs. And we're going to complete the entire process over again in a lying, sitting, and left lying position, just to make sure that we get good heart sounds in all locations. But I don't think we need to continue that. We'll just press on. We're going to go ahead and auscultate the apex of the heart. So what I'm listening is I would normally listen for a full minute, but I'm listening to not only the speed of your heart, but the rhythm of your heart as well. So we're going to go ahead and put this at the apex of the heart, and we're going to listen for a full minute. This is also where you would measure for a medication like digoxin, which is to decrease heart rate, and you would normally have to listen at the apex of the heart for a full minute. Rhythm is normal sinus rhythm in the 70s. Perfect. We're going to go ahead and move on to our abdominal assessment. So we're going to have you lay down with your head here again and your knees slightly bent. Sorry, Mom, I'm making you do all sorts of gymnastics. So we're going to go ahead and I'd like to start my assessment after washing my hands, of course, with actually palpating. This likes to give me a significant amount of information right off the bat. We're going to start on our right lower quadrant right here, and I'm going to gently palpate. This is a light palpation, and this is generally 1 to 3 centimeters deep. We're not going to perform a deep palpation because that is not necessary to do on my mother, and it can be unpleasant depending on where you're pressing. I don't feel any abnormalities when I pull the skin. When I pull her shirt up, the skin is of normal color. There are no scars, there are no wounds, ostomies, or anything of the sort. So, there are also no lesions or chest tubes. My mother has no abdominal history, and she's never had a C-section, so I don't expect to see a scar in that area either. We're going to go ahead and auscultate for the presence of our abdominal root with the bell of our stethoscope. Abdominal root is there, and then we're going to auscultate all 4 quadrants. We're going to start at our right lower quadrant, moving up to our right upper quadrant, moving to our left upper quadrant, and then moving to our right lower quadrant. Bowel sounds are present in all 4 quadrants, and you can listen up to 5 minutes if you're not hearing them. This is important, particularly following surgery or if they're under anesthesia, to make sure that bowel sounds have returned before they start eating, as they can cause nausea or vomiting if it hasn't and they've already begun to eat. We're going to go ahead and percuss all 4 of our abdominal quadrants. So I hear tympany in all 4 quadrants, indicating that these are normal findings. Dullness would indicate a possible obstruction or a mass in the abdominal area of the body, and dullness over the liver is normal. Any dullness found over the bowel sounds would also indicate that we would have an obstruction, which we do not, which is good. And then we've already done our deep and light palpation. So I'm going to actually have you turn over and lay on your back, or lay on your stomach, excuse me, for this portion. I'm going to be assessing you for my costovertebral angle tenderness. So this is on the 12th rib down. You're going to assess it on both right, left portion of the spine, both to the right and left of the spine, excuse me. And this is important as for somebody that might possibly have an infection in their kidneys. So you're going to place your palm flat and hit them with the palm, with the fist of your, with your fist. Okay, I'm going to go ahead and perform the maneuver. Tell me if you have any tenderness or pain, okay?
Mm-hmm. No. No.
Perfect. All right, that concludes the completion of our head to toe assessment. If you have any comments, please don't hesitate to let me know. And thank you, Mom, for being a fantastic patient. I appreciate it.
You're welcome.
I very much enjoyed this class, and I hope you have a great day. Thanks.